Hi, good afternoon. My name is Hilda Azani, and I'm going to present on Valium. I chose Valium because I listen to a lot of hip hop, and it came up as it always comes up in songs, especially by Eminem. And I guess growing up, I never really truly understood the concept, but now that we're here in the counseling program, it's a little different. Um, so basically, if I had a client that came to me that was prescribed the Valium, I would probably, and they have questions about it, I would probably first go over, make sure they understand their diagnosis. For instance, this particular client, let's say, struggles with anxiety, has been diagnosed with anxiety, and I myself been treating them um, for anxiety. And let's say she went to the doctor and she was prescribed Valium. So she's coming to me asking, what is this? I don't understand it. So I would let her know, um, first, because of your diagnosis, which is anxiety, Valium is one of the medications that are used to treat the disorder. And I would tell her it's going to help you, calm your feelings of worry and fear. Basically, just stabilize her. And it'd be important for her to understand that this particular medicine is used for anxiety. And excuse me. What else should I would probably tell her that you know at this point I'm thinking her and I have been working for some time together, and because of that, let's say we have maybe created a bond, or there's she knows me and I know her situation. We've had a few sessions, so she feels comfortable coming to me and knows that I'll explain it to her thoroughly. Now, I would probably say um, I like to do role playing. I think it's beneficial. So I would probably remind her of a time where we did the actual role playing as to what approach we're doing, I guess, through therapy. For instance, for anxiety, with the clients I have in my at my internship, I use CBT. I think CBT is great. I use the ABC model. So because it is a cognitive approach, what we're trying to do is change irrational thoughts. And by changing the irrational thoughts, as you guys know, of course, that will decrease anxiety, and the client will feel better. So it's a whole transition. So I will explain to her that her doctor's handling her medication, which is great, and I'm in charge of the therapy, and we kind of work together hand in hand just to make sure that everything is appropriate and to her advantage to help her through this. I would probably remind her something about when she was feeling anxious, and we validated her feelings, her thoughts, and were able to really analyze those feelings and thoughts, which will then, of course, lead to a more positive action. Once she takes the thought, she goes into the action, which of course leads to a positive consequence. For instance, let's say one of the examples that my client and I had, let's say she had a problem with let's say with dogs, and well, no, because that goes into exposure. Let's say she had a fear a fear for being alone at home, because she's afraid someone's going to break in. So because of that fear, I would say let's think about it. It's it's common to think that, right? I mean, you're home alone. Maybe it's dark and you feel alone. You feel lonely, and then you start thinking, overthinking, and you start thinking of scenarios that may arise, right? So she would probably be acknowledging this, nodding her head, maybe adding to the symptoms I'm stating, and then we would process them together as well. Maybe we shouldn't worry about it, um, unless it truly happens. For now, what we can do is what we can control is lock the door, make sure all the windows are locked, make sure your phone is charged in the event of an emergency, and just be aware of your surroundings. Maybe look out the window, see what's going on in the neighborhood, and that was the action she took because that's something she could control, which of course led to her consequence, which was being able to stay home alone for whatever time frame and confronting her fear, but not so much that she let it become a fear, more like she processed the thought and changed the whole action, which of course it never even led to the actual, I guess, panic attack or the anxiety. So I would explain to her that because of that, since we've been working with that now she's going to incorporate this medication, Valium, and it's really going to be beneficial to her because now she's getting both treatments together, which is it's great. I would assure her that her and I would continue to have therapy and meet weekly or however, maybe twice a month or however we have it planned out, and however her treatment plan is. Now, Valium, what I would want to explain to her about the medication, I would probably first make her aware of, I guess I would go with letting her know that Valium is, of course, like I said, is to calm her brain, her nerves, the activity going on, just to take a different approach. I would let her know that typically when you do take a Valium, of course it varies by person, but based on some of the research I did, it looks like it kicks in between between 15 minutes to 45 minutes is when they start feeling some kind of difference or even side effects depending on what comes. Excuse me. So I would explain to her that Valium is a it's hard to pronounce it, benzodiazepine. Benzos, let's just go with short term, I would tell her is basically known as a tranquilizer. But I would probably tell her tranquilizer not to like knock you out, like make you go to sleep, just more like calm, to remain calm in this situation. I would definitely disclose to her that because it is a benzo, it can lead to habit forming, which leads to maybe abuse of the drug and even overdose. So I would let her know that because of the, I guess, the side effects or risk that come with the medicine, I would probably let her know that it's important that she takes the medicine as prescribed. It's very important. I would let her know that as far as her doctor prescribed, she's to take the medication about 2 weeks. But the doctor can always increase it or decrease it based on how she's feeling. I would let her know that sometimes your medical insurance doesn't cover the actual brand, which is Valium. I would let her know that the generic brand name is diazepam. I'm sorry if I'm mispronouncing. And side effects are important, so of course I would let her know side effects. Common side effects are drowsiness, tiredness, dizziness, spinning sensation, and restlessness and dry mouth. Those are the top ones. There's more, but those are very common. Now, uncommon side effects are like confusion, hallucinations, unusual risk-taking behaviors, shallow breathing, and loss of bladder control. These are when she will be made aware that these are dangerous. We definitely need to contact her doctor right away if she's feeling any of these. And also, as far as her dosage, if she for some reason, forgets to take her dosage, if too much time has passed, then the best thing is for her to wait for the next day and take it, and not to take extra. It's important that she doesn't take extra. It's important that this medicine is prescribed to someone that doesn't have history of substance abuse issues with drugs, alcohol, because it is habit forming. It's very important that she does not discontinue using Valium without consulting her doctor, because it can lead to seizures or withdrawal symptoms. And some doctors do request frequent blood tests to test how much of the medicine is in the bloodstream. It depends. It's case by case, doctor by doctor. So that's the research I would let her know about. It is recommended that she does not consume alcohol, of course, drugs. And this one's new. I never heard of it. It's recommended that she does not drink any grapefruit juice or consume any grapefruit. Apparently, it causes feelings of being sedated. You may lose control, muscular movement, and you can't drive if you took grapefruit. Otherwise, you're okay. It is possible to overdose on Valium if you take more than what's prescribed. Now, the symptoms for overdose is drowsiness, confusion, diminished reflexes. That's definitely a time to call 911, get to a hospital for assistance. At this point, I would ask the client, do you have any other questions? Anything else I can help with regarding the medication? If she did, then we'll address them. If she didn't, then I would just let her know that, excuse me, although it seems like there's a lot of negative, I guess, side effects to the drug, I would let her know that all medication, all drugs have side effects, but the goal is a doctor will not prescribe a medication unless the doctor feels that it will be more beneficial to the client rather than harmful. So it's important that the client knows that way they don't feel like, well, why am I even taking this? Like, what else can happen? So those are pretty much the basic things I would let her know about. Of course, I would let her know about, because it's habit forming, about maybe becoming dependent on the medication, even tolerant, where you need to increase the dosage. And I think that's all about how I would treat it with my client. Thank you guys for watching. Have a good night.